Hi, welcome to our poster on impacts of aromatherapy on postpartum depression. My name is Katie Johnson, and our other group members are McKinley, Crowson, Morgan Halenkamp, Dara Humphries, and Megan Miller. This slide shows our poster, and all the contents will be covered in the next few slides. So the background for our topic is postpartum depression is defined as long-term depression in a mother following childbirth. It includes symptoms such as fatigue, irritability, tearfulness, loss of motivation, and decreased interest in the child. Some treatments include antidepressants and psychotherapy, but adverse effects are associated with many antidepressants. Now we have McKinley with the clinical question and search strategy.
Thank you, Katie. Our clinical question is, in postpartum women, does the use of aromatherapy reduce the risk of postpartum depression compared with drug therapy alone? Our search strategy consisted of keywords of postpartum depression, alternative therapy, and aromatherapy. We utilized databases such as OneSearch, PubMed, and EBSCO, and our criteria used was the publication must be published within the last 10 years. Now I'm going to be passing it to Morgan to discuss the synthesis of evidence table and findings.
Thank you, McKinley. The synthesis of evidence table analyzes all of our sources, including limitations, findings, evidence type, sample size, and gives a rating on level and quality. The findings are: aromatherapy was found to be effective for postpartum depression based on the evidence researched. Limitations such as hormonal factors could influence and improve depressive moods. The results support that bergamot essential oil aromatherapy has a positive effect on depressive moods in postpartum women in 2 weeks. Aromatherapy shows a positive improvement in maternal health and is suggested as a non-pharmacological method for postpartum depression. Studies provide valid evidence for the effect of aromatherapy on PPD and is highly recommended. Now I'm going to pass it on to Megan, who will describe the implications for practice.
Thank you, Morgan. Now I'm going to talk about the implications for practice. Utilizing aromatherapy for postpartum patients increases available treatments for the complication of PPD. Decreased postpartum depression can improve health. Decreased postpartum depression can promote bonding between the mother and the baby. And finally, aromatherapy can be a prophylactic therapy to prevent PPD and to improve quality of life. Next, I'm going to pass it to Dara, who's going to talk about our summary.
Thank you, Megan. The summary of our findings is encouraging the use of essential oils during postpartum may prevent the development of postpartum depression by affecting neurotransmitters. Aromatherapy prevents the progression of PPD symptoms. Aromatherapy has been proven to improve mood in postpartum mothers. Results suggest that aromatherapy is a useful or complementary or alternative treatment. These are our references. Thank you so much for listening to our presentation.